This conference will now be recorded.
Okay, perfect. All right, so everybody, welcome to the Division of Public Health and WEA Hypertension Pilot Pharmacist Training. My name is Carrie Trapskin, and Kelvin Lee, my student, is going to be training with me as well this morning. Okay, so we are very lucky to receive funding from the Centers for Disease Control via the Wisconsin Division of Public Health. We've been doing this partnership for almost 5 years now, and just been really fortunate through the Wisconsin Pharmacy Quality Collaborative to have their support. They work a lot around through the chronic disease prevention program. They work a lot focused on hypertension as well as diabetes, as well as they're very interested in medication therapy management, and there's a huge focus on pharmacists. So it's a really, really nice partnership, and that is one of the reasons we've been given this opportunity to work with pharmacists, specifically with WEA Trust. So WEA focuses on the whole state, but they have pockets of places where they have more, more opportunities with patients, given that they service a lot of school districts. So we're very excited that this has brought us also an opportunity to work with WEA Trust. And the cool thing is this is the second round of this pilot. The last round of the pilot was sponsored by a group through the CDC, but entitled the ASTO. It's called the Association of State and Territorial Health Officials, which is a group that takes CDC funding, passes it off to the Division of Public Health, and then they pass it off to people like us. So that was the way we paid for this process the last time around. And this time, because it went so well the first time, WEA Trust is actually paying for the pharmacist services to be provided. So I'm very excited about that, and hopefully it'll turn into even more opportunities for us.
That's
so
great.
the goal of this pilot is to be to show that it's feasible. We're also utilizing a multifaceted marketing approach. So when I was approached with this opportunity, given our years of experience with working with payers and working with the WPQC program, I really was cautious and said, you know, I don't really want to do the same thing that we've done before and expect different results. So I really asked that the insurance company be involved in active marketing with the pharmacies, so that it wasn't just on the pharmacies to make sure that the patients came in. It would be a mailing and follow-up phone calls from the insurance company as well, so that it was really more of a partnership versus putting everything onto the pharmacist. And then we've also kind of dabbled in this value-based payment model. It's more of a hybrid between a fee-for-service and value-based payment model, but we've incorporated a couple of things that aren't entirely fee-for-service. So you may wonder how you were chosen to be part of this pilot. We were able to work very easily with WEA Trust the first go around with this pilot, which was held between May and middle of July. And we identified 6 pharmacies. And actually, one of you guys was part of that first analysis. We were trying to target a couple of different areas in the state. We ended up targeting Kenosha and Sauk counties, given the high numbers of members that WEA Trust has in those areas with hypertension. So we were able to meet with WEA a couple times and the Division of Public Health, and they ran a really, really nice report and sliced and diced it a couple different ways to figure out which patients had hypertension, low proportion of days covered for adherence, and then we layered on top whether they were WPQC pharmacy, which county they were in, and then we wanted to make sure that we would find the individuals who are associated with a specific pharmacy, because we were really focused on WPQC pharmacies. So it limited, given that there's just a limited number of WPQC pharmacies, but we knew we'd have a better ability to outreach to WPQC pharmacies and others, and wanted to offer WPQC pharmacies a special opportunity. So this go around, we wanted to select additional pharmacies for outreach for participation. So we went back to that same list, refreshed it, and identified Antigo as well as Reedsburg, and then we'll be working continued work with Shopko in Kenosha. So here are the 3 pharmacies that I mentioned. So these are patients who are on or you'll receive lists of patients with a significant number of antihypertensive medications on their list. So we decided that given the limited numbers of patients who actually showed up with low adherence, that we decided that we would not necessarily limit it to those patients who look on paper like they haven't refilled their medications regularly, because, and this bore out in the last pilot, that we were showing that basically, even if people look like they're adherent, they may not be meeting their blood pressure goals, or as we all know, they may be stockpiling medications. It doesn't necessarily equate to true adherence. So the patients that you will receive are not necessarily those with low adherence, but they may be. So you guys have already received the information about doing the home study training videos on adherence to blood pressure medication. So those are those really quick videos. And then home study self-assessment of blood pressure and blood pressure technique videos. Those are 2 videos. They're about 35 minutes each. If you haven't watched them, I think they're worth watching. Some of the things around blood pressure seem so easy, but the more I've learned being involved with the Division of Public Health, the more I've realized how important correct technique is, and our whole health system has issues with this and can improve. So, you know, if pharmacists can lead the way in that, I think we're the better for it. And then this is the webinar that we're providing you prior to launch. So let's talk a little bit about the pilot process. As I mentioned, the multifaceted approach to marketing. WEA Trust is actually going to be mailing invitation letters to patients associated with your pharmacies tomorrow. As far as I am aware right now, that's what we had asked, that they mail them tomorrow. It'll request in that letter that patients contact your pharmacy for an appointment to participate. So it'd be really smart to let your staff know that this may be coming. And they may or may not call you, given the effectiveness of patient mailers, but at least it's in their hands and they can see that they've received something and this is a real program that they're being invited to participate in. It lists in the letter patients' incentives, so they'll receive a free blood pressure monitor and a $25 Quick Trip gift card for participating in the program. And I will send you a copy of that invitation letter so that you guys know what's being sent out to them as soon as I see it from WEA. So that can be this week yet. This is the letter from the last go around. It comes directly from Alan Lukachevsky, who is the Director of Clinical Pharmacy at WEA. It does also talk about their incentives. And then this is also a flyer that goes with the mailer and describes in a little bit more of a pictorial version what they will be doing. So then WEA will be providing you a list of qualifying patients. Last time they sent it via secure email from WEA to your main contact. So that would be you, Brad, and you, Tia. So it'll come to you via secure email. You guys have closer to the 35 to 40 patients identified per site. So this will be provided to you quickly. I know that the individual from WEA was working on this week. So I anticipate that you will probably receive that soon. Has anybody received anything in your email, by the way?
I haven't yet.
Not yet? Okay, all right. Well, that should be coming. So then the multifaceted approach here requires you guys to reach out to your patients on that list. You can reference the mailing that's sent approximately, within the week prior. Invite them for a visit and to participate in the program. We have a communication script that I will send out in an email after this call with all of the materials that you'll need as documentation materials, etc. And if you have a well-trained student or technician, they can absolutely assist you in this, and I would actually encourage you to utilize them. And then there's also in the video script that we offer, that we provided you, those 3 individual short videos about adherence. The script number 1, the scenario number 1 can be utilized as an example of how to invite a patient as well. And of course, you have a lot of rapport with your patients, so you can utilize that as well, but we just give you some ideas for helping you out. So outreach has to occur quickly because we're on a really quick timeline. Technically, the Division of Public Health needs to utilize this funding by the end of the month, by the end of September. So we will do the best we can. And I just ask that you guys, give it your all, and we'll do the best that we can. Sometimes there are extensions that are provided as well. And sometimes we literally can get the funds and then continue to provide the services after September. So we'll just see. But at this point, we're working on both visits need to be completed before the end of September timeline. So we ask also that you try to reach the patients at least twice. So, don't give up after you haven't reached them the first time. If you can't reach them, or if they, say no the first time, obviously you don't need to reach out to them again, but please try to reach them at least twice. And then what will happen, and this really depends on how fast you reach out to the patients, but you will then provide a list of people who are uninterested or unreachable to WEA. So Elizabeth Solomon is going to be our assistant who's helping out at WEA. Her phone number, her fax number is there. I can also provide you her email as well. And I think it's better to actually fax her the patients, given that it's PHI that's going to be sent, and unless you have a way to do a secure email. I know that Reedsburg, you do have a way to do a secure email. Brad, I'm guessing you guys don't. But if you do send patient names, obviously through secure email is preferred. And if you could note on the spreadsheet that you received from WEA the outcome of your contacts with the patient, that would be helpful, because then WEA can reach out to those patients as well and see if they can either reach them or sway them to participate in the program. And then they'll be back in touch with you to let you know the outcome of those follow-up calls. So that worked really well the last time. It was a really nice way to partner with WEA. So hopefully it'll work the same this time. Now, the tools for the pilot, our staff will be mailing tools or delivering tools. So we're I think Calvin has reached out to both of you guys, so we'll be in touch after this call to see how we might be able to visit you or mail you the materials. So you'll be receiving one iPad, and you'll be able to keep that after the pilot. Hopefully that's not any issue like with Wi-Fi or any of that. We have run into that a couple of times where it's challenging to even get it hooked up. But the reason we're giving you an iPad is so that you can have the patient fill out an online survey at each visit, at visit 1 and at visit 2. So it just makes it easier for everybody. We'll also be delivering you home blood pressure monitors and or mailing them to you. We have a bunch left over from the last time, so that's why we need to deliver some of them, and we'd like to come see you as well. So every patient will get the home blood pressure monitor. It comes with a nice case, and I think it's a pretty nice one. I think it's like the Omron version 10, I think. So, and then after the pilot, the patients will receive a Quick Trip $25 gift card in the mail from WEA Trust. And so that's after they've completed visit 2. We'll also send you patient brochures as well as brochures or flyers related to how to self-monitor blood pressure, and that you should provide to the patients at their first visit. So you guys have seen these. I emailed them out. So if you haven't had a chance, please go through these videos. So the 2 Metastar videos, we worked on one of them with Metastar. The first one is really basic, how to take a blood pressure, done by Linda Murakami from the American Medical Association. And the second one is the one that we worked on actually with Metastar, which is the quality improvement organization in Wisconsin for CMS. And they do, that one talks about patient self-measurement of blood pressure, which is really, really important. And then the adherence and motivational interviewing, short little vignettes. Those go along with the adherence toolkit that you should have from being a WPQC pharmacy. If you don't, please let me know and I will forward you another copy. We also just launched the new PSW hypertension toolkit. It contains the new ACC/AHA guidelines from 2017 as well as the JNC8 guidelines. So it kind of updates and adds to the previous hypertension hyperlipidemia toolkit. If you weren't at the annual meeting, which I don't think you guys were, I know I will actually get these
patient team
out.
That was needed. We didn't have anyone from community. Yeah.
Okay, yeah, so no problem at all. But I will actually get you guys a copy of the new hypertension toolkit sent out to you guys, so that you have access to these new tools. So really the general concept here will be the most helpful. It's still up in the air. I think what most organizations are doing with the new hypertension guidelines, and there's still some controversy. We had a pretty good session at the annual meeting actually that kind of went through both sides of the coin on that. So it's going to be up to you guys which goals you use. And what, talking with the patient in terms of what their goals have been established with their provider. But hopefully it's all laid out here for you. And then this is the adherence toolkit, which you guys should have in your possession. So I would consider reviewing this, as well as there's a link here. I'll send you this presentation as well, but there's supporting materials that go with the toolkit. If you just have a few minutes to click through them, you may find some stuff in there that could help you with your conversations about adherence. The adherence toolkit was really based on social determinants of health. So looking at how to break down your conversation with a patient to figure out what barriers they have, not just based on remembering, but based on financial and system barriers to adherence. So really thinking about things more in terms of social determinants of health and what's really affecting people's ability to be healthy. I highlighted here one section on recall resources for your practice. So we actually have a pretty nice compilation that the PSW Adherence Competence Collaborative put together. When your patient does have problems with remembering, and that is the reason for their barrier to adherence, different things you can utilize for helping specific patients around remembering their medication. So again, here's the different barriers that go with the adherence toolkit. So now let's talk about incorporating the adherence encounter into the hypertension pilot visit. So as you guys know, you're trained to do the comprehensive medication review through WPQC. This is really supposed to be 2 visits for this specific patient that are focused on hypertension. That being said, you got to have a list of the patient's full medications before you can really delve into just hypertension, since there's so many things that affect hypertension. So We do encourage you to do the full medication review, but then just focus your efforts on hypertension and adherence to hypertension, building in focus on self-measurement of blood pressure. So the adherence workflow, this is covered in those quick vignettes that Heather Stoner, one of our previous students, is the videos that she created with us. So the idea is to screen your patient. There's a screening form in there that allows you to figure out kind of what their barriers are. And then if you just have a short amount of time, or you really feel like, okay, let's just get a sense of where this person's at, then you use the assess and address sheet. If you have longer time, you have a time, and this would be what you would use for this one, is the developing really more of an action plan for the patient around adherence. Then you use the solve and involve pathway and help them figure out what are the resources to help them with their medication action plan, and there's also a medication action plan in there. So all of these materials are actually found on the website that I referred you to previously. Okay, so screening for non-adherence. We really suggest that, and this is completely up to you, especially since this is a short pilot, whether or not you have a pharmacy technician that could be in this role. But to engage your pharmacy technicians, they can be very, very helpful. Screening always for non-adherence by refill history is part of the preparation for the visit. So, use the questions from making the most of my medications. Those that we've actually incorporated into the H&P intake form that you can actually have the patient fill out while they're waiting for the appointment or before they arrive. So you'll see that in one of the next slides. And then use those answers to guide your visit. So here are the questions that are incorporated into the actual H&P. The icons there, or the graphics on the left, pertain to the actual graphics in the toolkit, the adherence toolkit. So that, like on number 2, that little string around the pointer finger is the typical, like, remember or having challenges remembering. So based on the answers to these questions, which are again incorporated into the H&P, based on the answers to those, you can kind of figure out which domain you want to focus on. And then in the adherence toolkit, there are suggestions for how to use really good motivational interviewing communication skills to be able to communicate with the patient to help around their specific barriers. Okay, so I'm going to turn this over to Calvin, actually, and he's going to walk us through a little bit more in detail around the adherence work as well as the visits.
All right, so assess and address. This is a step ideally you'd like to get it done within less than 5 minutes. Shouldn't take super long. We do have trigger forms for you to utilize just to help identify barriers for the patients and just helps facilitate discussion regarding barriers for the patients, and it also helps build rapport. So this is the form, the assess and address trigger form. They do have some statements on here, but it's not really a script per se. It's more of a way to guide and facilitate discussion with your patient, and it can help incorporate some of the motivational interviewing skills into the consultation with the patient. So the next step is solve and involve. And at the end of every comprehensive medication review, you do need to provide a medication action plan to the patient, as well as a patient medication list. So this step is really to help you involve the patients and incorporate them into their own care and to promote self-efficacy for the patient. And it's a way to help develop the action plan and to determine the target goals and behaviors for the patient. This is the form that you can use for the solve and involve step. As you can see, there are about 3 steps here, so you can summarize the goals or target goals that the patient stated during your visit. One way is to make a SMART goal with the patient, make something a bit realistic for them to aim for. It gives the patient something to strive for. And the last thing is to elicit a commitment statement. Similar to the teach-back method, this is really to help you gauge the patient's understanding and just to make sure that you're both on the same page in terms of the action plan that you developed together. So this is more of the solve and involve step. What I like to point out here is step 7, to establish a follow-up. One thing that we do want you to do is to make sure that the patient understands that they are expected to come back for a follow-up visit. This is actually part of the value-based payments. To receive the full payments for these services, the patient does need to show up for both visits. This is the medication action plan that I did talk about before that you would develop with the patient. It's pretty self-explanatory, and it's just a way for the patient to record their plan that you did develop together. It's really an agreement between you and the patient and what they are agreeing to do. And again, it's important to mark down the dates for the follow-up visit on the bottom right there, just so the patient understands that they do need to return for a visit. The follow-up visit should occur about 2 to 4 weeks after the first visit.
So again, if you guys, depending on when you get them in for the first visit, it's completely fine that it could be a week later even with our short timeline. Ideally, it would be between 2 and 4 weeks, but it could be as quick as 1 week or a week and a half, just given the timeline.
Okay.
So those were steps for more for adherence consultation, but I'm just going to take a step back here just to go to the beginning of the process of the comprehensive medication review and just how the process should play out. So you already have an agreement worked out with your PBM in terms of patient PHI. This agreement is more for the patient. This agreement is more for the patient to say, "Hey, I know what I'm participating in, and I know my information won't be sold somewhere else." So this agreement, I believe, we're sending it out?
Yep, we'll send you guys actually the form after this call. We'll send you guys the patient authorization agreement. It's really just, like it says here, details your mutual understanding that the patient's going to attend those 2 visits. They're going to be 2 to 4 weeks apart, and that the incentives are there for them. So the HIPAA process that you guys have with your patients is already in place, and you still need to do that. It's just that this is the authorization that the patient understands what they're going to be getting, and hopefully helps you to get them to come back.
All right, so for the first visit, it is a comprehensive medication review, but it is focused more towards the adherence to their hypertension medication, along with the focus on the self-monitoring of blood pressure. So the first 2 training videos, scenario 1 and 2, and their scripts should be pretty useful for this first visit, so I would highly recommend reviewing those videos. When they first come in for the first visits, we would like them to take the pre-visit health survey that you can use the iPad for that we provide you. And you want to use the unique identifier that WEA Trust will provide you on their patient list as well to sign them in for that survey. The patients will complete the pre-visit health survey on the iPad, and we'll give you the link for the SurveyMonkey survey as well. And you'll queue up the patient's survey using that unique identifier. And the survey is just more of a health belief survey and a way to record the patient's blood pressure during the visit, just so we can keep track of their progression with the program. So visit 2, which again, ideally it would be 2 to 4 weeks later, but given the short time frame we have for this, it could be 1 week as well. So this follow-up visit is also targeted towards hypertension medication and blood pressure monitoring at home and their progress with that, seeing if their technique has improved or if their adherence has improved. And for this one, the training scenario 3 video and script could be helpful for this too, so I'd recommend reviewing that video. And similar to the first visit, they'll just be doing the pre-visit health survey on the iPad again and using that unique identifier from WEA Trust. And the survey is, I believe, pretty similar to the first one, just about health belief and recording the patient's blood pressure and heart rate. So to get into the details more of the first visit, we do want you to provide a full comprehensive medication review through the training that you went through for WPQC. We have a patient intake form that you want to provide to the patient before their visits.
And that's the H&P form that I was talking about before.
Yep. And you want to utilize the level 2 hypertension documentation form just to document everything that happens during the visit. This is the same one that you use to document for Medicaid, but we customize it just to make it geared more towards hypertension. You'll want to take the blood pressure and heart rate, and you can tell the patient the details, or tell the patient the results, but you don't want to go into the details of their blood pressure and heart rate measurements. And you just want to enter those values into the survey, the pre-visit health survey that we talked about just before. Again, the patient health survey occurs on the iPad before the service begins. You'll want to go through the patient's goals, address any questions and concerns they might have. And we do want you to do a full medication history. Even though this program is focused on hypertension, we still want you to do a full medication history, so please do address any issues that you see fit, even if it isn't specifically related to hypertension. You can ask the specific highlighted questions on the documentation form, the level 2 hypertension documentation form that is provided. That form has the highlighted questions are just questions that are more geared towards hypertension and addressing maybe common problems and issues that patients might have regarding their medication or just monitoring their blood pressure at home. And then you just want to educate on the self-measurements of blood pressure as well. We will provide you an educational sheet that you can go through with the patients. And lastly, you want to provide the patients a medication action plan and a personal medication list, which you can mail. Sometimes it's not feasible to have that complete right away during that visit. So if you need a few days to get that done, it is okay to mail that to the patient. So this is the H&P intake form that Curie was talking about before. This is what you want to give to the patient before the visit. It just helps collect some information that would normally be collected during a visit. So it just helps save a bit of time for you and the technicians as well. This is the level 2 documentation form that I was just talking about. You can see you definitely want to cover hypertension under the chronic conditions, and under med device instructions, you want to cover blood pressure monitor. Everything else on this first page, you definitely can cover. I would suggest going over everything as well. It is a comprehensive medication review. On the right side, you can see consult and during visits. You can enter the lab values that you get for the patients over on the right side. And the bullet points are just the statements and questions you can go through with the patient just to get more information from them. So this is the blood pressure monitoring education form you can give or go over with the patients. This is just one example of it. We will provide you these forms. This one specifically comes from the American Heart Association and American Medical Association. This is one that we developed here at PSW. Both have very different looks, but they do convey the same message, just showing what the patient should be doing in order to get an accurate blood pressure measurement.
So just to add one thing to this, so I think it's very interesting and telling. If you look at the first one that's from Target BP from the AMA, if you look at that one, you can see that it's pretty general and more patient-facing. There's another brochure similar to this that is actually more healthcare provider-facing, and actually those circles that talk about the important things for patients to do actually have in them how many millimeters of mercury your blood pressure can change either way based on if you're not positioned correctly. So in the hypertension toolkit that I will mail out to you guys, in the toolkit, there's actually we kind of combined the two documents so that you can use it as a patient you can use it for patients, but you can also use it for yourself in that you can look and see how many millimeters of mercury you're going to be affecting the patient's blood pressure if you aren't, for instance, having their feet on the floor, or if you're talking while you're taking the blood pressure, or if you're taking the blood pressure over a sweater, etc. So just kind of FYI, I think those are pretty cool and worth your time to look at, even if it's just to help yourself realize how important it is to position the patient correctly.
So this is just a blood pressure log that you can give to the patients for them to be recording their blood pressure daily. If you do have your own that you prefer to use at your pharmacy, please feel free to use that. This is just one that we do provide, but feel free to use your own as well.
Quick question. Do you normally provide that little sheet? Do patients get a copy of that sheet to help them measure their blood pressure accurate?
Yep. This one or the other one?
Mm-hmm. Yeah.
Yeah. Yep. So we'll send you guys like a packet of those, one per every patient, like printed out in color. We'll also send it to you in a PDF format. So if you want to print more, you're welcome to. But yeah, we suggest that you provide that to the patient. The survey questions in the Health Beliefs survey, which you'll see also in our communications. The survey questions do include questions about, it's based on a pre-post survey, so you'll see questions about how often or what's their understanding of self-measurement of blood pressure, and then that same question will be asked of them in the second visit. So the goal really is to show that their knowledge and confidence went up between the two visits around self-measurement of blood pressure, as well as recording their blood pressures and tracking them.
So again, this is just the medication action plan that you come up with the patient, and this is something we will provide for you. This resource is called Resources to Help with My Medication Plan, and this is something for the patient that they can use for you to go over with them, just to help them overcome some of the barriers that they might have. I believe we do have a Word document of this form that you can customize as you see fits. For example, if you have a local senior center and you have a specific number for that senior center, you by all means can put that down in the documents, and just to customize it more towards your own community with the patients. So that's the first visits. And now for the second visits, to go into a bit more detail, it is similar to the first visit. You do want to utilize that level 2 documentation form again, and just to check the follow-up box that is on the form. You again will take the patient's blood pressure and heart rate, and again, just tell them the results, but don't go into detail about it. And enter the values of the blood pressure and their heart rate into the survey link. Patient will take the health survey again before the service or the consultation will begin. I want to go over the patient's goals and any questions, concerns they might have. And here, one thing that is different, you will follow up on the intervention from last time. Again, going over those specific highlighted questions on the documentation form and just checking their adherence and their monitoring technique and just reinforcing the concepts you went through last time. And if it is applicable, you just provide another medication action plan or personal medication list if there is anything to update on those forms. If not, then you don't have to worry too much about that.
And just to clarify, you know, with the point of taking the blood pressure and heart rate and telling the patient the results, but no additional details, you definitely can go into the details after they've filled out the health belief survey. We just don't want to impact what their health beliefs are before they fill out the survey during the pre and post visit. So just so you know, we're not like withholding information.
Oh.
So this form is just the adherence follow-up guide that goes along with the adherence workflow. It just provides statements that you can use to facilitate discussion regarding the progress of their adherence thus far. This one is just a documentation form. Since the follow-up visit is required to be in person, but if you feel that the patient does need additional follow-up whatsoever, please feel free to reach them by phone, just to reinforce any concepts or address any questions, just maybe even just to check up on how they're doing with their adherence. So a few tips for efficacy here. You can utilize a well-trained technician to manage some of the portions of the process, such as reminder calls, checking their blood pressure and heart rate if they are trained to do that, or just distributing the survey as well at the beginning of the visit. A good thing to do is to use a clock in the room, if you have one, just to cue you and the patients. Sometimes patients can kind of get off track. I understand that. And it might be difficult to redirect them, but if you use the clock, you can say, oh, there's only 15 minutes left. I'd really like to get into this and this. And it's just a way to help redirect the conversation and target it more towards what you want to accomplish during the visit. Another way is to have the technician or another colleague just knock on the door when there's 5 minutes left, just as a reminder about how much time you do have left and how much time you've been spending with the patient. And it's good to set the expectations early in the visit, just maybe saying like, oh, we have about an hour, about half an hour to spend with this visit. I'd like to get through this, this, and this. And
then I also would suggest that you the conversation to what the patient wants. So try to say like, oh, so in the beginning we decided that these were your concerns, so we want to be sure to get this and this and this, and then I want to, as the pharmacist, you want to talk about 2 or 3 things. So going back to what those expectations are of you and the patient too, so that it's very patient focused and they can feel most engaged. And hopefully that helps to redirect the conversation.
So invoicing for these services, compensation. So services, you will receive $100 each per patient per visit, and up to $5,000 per pharmacy. So, for example, if you provide the CMR to 10 patients per pharmacy and each patient had 2 visits, that would be about $2,000 for the pharmacy. You'll each receive $500 flat per pharmacy for the time that you spend providing outreach to the WEA trust members throughout this pilot, and another $500 flat per pharmacy for collecting the data during this pilot. PSW will sign a basic agreement with each of the pharmacies, and we will provide an invoice for you guys to submit, I believe, back to us.
Yep.
And W-9 will be requested as well.
So I have contracts from, I believe, both of you guys. So we will, if we haven't returned those to you yet, we will have those returned to you so that the process is rolling. And then, like I said, or like Calvin said, we'll have the W-9 sent out as well for you to sign, just so we are able to pay you. The actual payment occurs after the pilot is complete, so we'll provide you an invoice at the end when we close out the actual pilot, and then we'll have you return the extra incentive gifts. Like, for instance, if we provide you, 15 blood pressure monitors and you only see 10 patients, then we'll get the other ones back from you.
So here we do have some results from the first pilot that we ran earlier in the summer. So during the first pilots, we identified 61 members who were eligible for the program, but only 36 ended up participating, which is 59%, which is fantastic.
Yeah, it's really great.
And 100% of those patients completed both of their visits,
which is really amazing. So kudos to all the pharmacists that participated.
We're hoping to get results like that.
Yes, exactly.
For this pilot as well.
No pressure.
So the first thing we did ask the patients, we asked them, what do you think your blood pressure number should be? So this is for systolic blood pressure. And you can see during their first visit, 5 patients did not know what their number should be. But by the time the second visit came around, we did not have any patients who did not know what their blood pressure should be in terms of systolic blood pressure. And I believe their diastolic, it was a similar situation with that. 5 patients did not know what their diastolic was or should be during their first visit, but by the time the second visit came around, they were aware of what their blood pressure should be. So the second one, we asked, do you use any of the following to help you manage your blood pressure? During the first visit, only 9 patients said that they use a monitor to check their blood pressure at home, whereas only 3 used a log to keep track of their blood pressure daily. By the time the second visit came around, we had 33 patients checking their blood pressure at home with a monitor, and 31 recording it on a log. So these results are great. Again, we are hoping to see something like this. Just a few more results. 100% of the patients responded agree or strongly agree to the statements. As a result of my visit today, I'm going to take a more active role in managing my blood pressure. So we're really hoping to support the self-efficacy of these patients with the comprehensive medication reviews and hopefully have them take more control over their high blood pressure and their medication adherence. The actual measurement averages for the first and second visit. The first visit, you can see the blood pressure was 136/84, and the second visit, it did decrease a bit. And 13 out of the 15 uncontrolled members found in the first visit were actually adherent to their blood pressure medication. So this just goes to show that sometimes adherence isn't always the issue. And maybe their blood pressure medication is just subtherapeutic, and they could just, that is something to address during the visit as well. Some patient testimonials from the first pilot. One patient said that it's just extremely informative, and it just helps them make changes to the routines regarding their health. And another patient just said they like that the pharmacy is also an advocate in their care. So these patients really seem to like this program.
We'll send you out a video as well that we showed at the annual meeting that I think will kind of just put it all together for you. A patient from Kenosha that met with the Good Value Pharmacy. And, you know, there's more patients like that, but we were able to record one patient's experience, and it was pretty telling, I think, and really motivational for us to see, at least. So hopefully you guys will feel good about that, and it'll get you motivated to see what you can do for the patients in your area.
So I'm sure you guys have questions, but we did anticipate a few. So what if you identify other WEA trust members who have hypertension but are not on the patient list? For that, you can contact Carrie, I believe, and she will connect with WEA Trust, and they will definitely get that sorted out.
Mm-hmm.
When will this pilot be ending? Again, we are hoping to begin about first week of September, first week or two, as soon as these letters get sent out from WEA, which I believe we're aiming for either
Friday.
Tomorrow.
Actually, yeah. Tomorrow or Friday.
Tomorrow. Again, the timeline is short. We will be checking in regularly just to see how things are going.
And please, if you have questions throughout, do not hesitate to email me, WEA as well, but I can definitely be your conduit. But we'll be checking in, sending you things if you're confused or just have feedback for us. We'll definitely appreciate it. There will be a feedback survey at the end that we'll send out, once the whole thing is done, just to see how we can improve for the future, kind of just your experiences. In general, the pharmacists thought the whole process was very manageable. So you guys do have a significant number of patients. So I know, Good Value Pharmacy was actually the pharmacy that had the most patients last time, and they were able to get a lot of them to come in and see Andrea, the pharmacist there. So, hopefully it'll be very doable. And I guess we're assuming you'll have the 50 to 60% acceptance rate. So even if you do have 36 or 40 patients on your initial list, we're assuming that you'll have that 50 or 60%. Now, if you get all the patients to come in, we can also look, re-look at that, and that would be an amazing thing. So if that's the situation, we can make some tweaks to a lot of things in this pilot. So just do your best. We're really excited for this. So are there any questions that are coming up at this point in time? I think everything will become clearer as we send out more of this information, but I'd love to take questions that you have at this point.
Just one question I have. I'm taking notes on this, but as far as like having access to these slides to kind of put this together in my mind and how to so I don't miss anything.
Yep, we'll definitely send this out.
Okay.
Yep, we'll send it after. Would you like the recording as well, or just the slides?
If you can get the recording too, that's great.
Yep, we can definitely get the recording. It will be probably later today, but we can definitely get it. And expect a couple more emails from us with all of the documents that go along with this. So that'll kind of allow you to put all the pieces together too.
Good.
I was going to say before, the pharmacists who have already participated, I believe kind of their average for the first visit was about 45 minutes, just so you can kind of gauge that. And again, it's going to just be really dependent on the patient. But the main things we want you to focus on are the hypertension medication, self-measurement of blood pressure. And there were the last go round, we do know that pharmacists went into a little bit more detail on exercise and just lifestyle, et cetera. And we had heard that there were other recommendations that came out of the comprehensive medication reviews as well that maybe weren't even related to hypertension. There were dose changes, that kind of thing too. One question that we had was whether the documentation forms needed to be turned in to to me or to WEA, and they do not. The only thing that you're passing along is the information that's through the survey link for the Visit 1 and Visit 2, that health belief survey. So the documentation forms are really for your benefit, and we aren't capturing any of that other information. It's really for your own follow-up purposes. The patients that were interviewed, you'll see in this video that I send you, it's really kind of telling. The one woman says, I never knew that my pharmacist could call my doctor to ask a question or to make a change or that sort of thing. So, that was really, really telling for us, that just sort of, we know there's patient perceptions out there that, really don't perceive what pharmacists can do, but I thought that was pretty telling. So she seemed really happy at the end that she now has a really nice relationship with her pharmacist that she didn't even realize could exist before. So any other questions? None? Okay. Yes. So we also, Calvin had some emails going out to you guys for site visit times. I think we'll just follow up via email, but just know that we're in the process of trying to figure that out. We may call you separately to get those set up, just to avoid like the back and forth via email. But we would really like to come visit you, and it may just be Calvin, it may be Calvin and I, just depending on the schedule, but we'd like to come visit you and deliver your materials and just kind of see what we can do to help you. Any last questions? Okay, well, thank you so much for your time. Hopefully this was useful, at least to give you a taste of this, and we know that you're going to be synthesizing things, and please let us know if things aren't coming together for you. And then stay tuned for some more information via email really soon. So have a wonderful day, you guys, and we'll talk to you soon.
All right, thank you.
Yep, bye-bye. Bye-bye.
This conference will now be recorded. This conference will now be recorded.